Good evening. My name is Roxanne Chabot from RBC Consultants. Welcome to another Skin Chat. This evening, we're going to be talking about dandruff dilemma, treatment challenges, role of scalp barrier, and the importance of scalp and hair care in the overall management of dandruff. Our speakers this evening are Dr. Maria Hordinski, who is at R.W. Goltz Professor, Vice Chair of Research, Director, Clinical Research Division, Department of Dermatology at the University of Minnesota. We also have with us Heather Woolery-Lloyd, who is Director, Skin of Color Division, Dr. Philip Frost, Department of Dermatology and Cutaneous Surgery at the University of Miami Miller School of Medicine. We'd like to thank our sponsors, CeraVe, for making this educational event possible. Before we begin, a couple of logistic tips. If you're having issues hearing the webinar, you can listen to the presentation using your telephone. Just select phone call in the audio pane and the dial-in information will be displayed. If you're having technical issues or if you would like to submit a question to our faculty, please submit your questions in the question chat pane on the right-hand side of your screen. At the end of this webinar, a survey will be emailed to you within 1 to 2 days. We'd greatly appreciate it if you could fill it in and send it back to us. And finally, within 1 to 2 days of the webinar, a certificate of attendance and a recording will be sent to you. Again, if you would like to ask questions to our faculty, please submit your questions in the question chat pane on the right-hand side of your screen, and I wrote a little note there so you could see exactly where you needed to write the question. So without further ado, I am going to pass the floor virtually to Dr. Maria Hordinski.
Hello, everyone, and welcome to this session after a long day in clinic. So I'm thrilled to be able to talk to you about this topic. And let's see if I can get that slide to move here. Okay, so going backwards here, my apologies. So the topic tonight really rests on these two articles that came out fairly recently. One is titled The Insights on the Impact of Scalp Barrier Condition on Hair Health, and the other is on the etiology, treatment challenges, and the role of scalp and hair care in managing dandruff. These articles were published recently in the JDD. So what are the objectives? We're going to discuss challenges in hair and scalp health in patients with dandruff, discuss the importance of hair care in managing dandruff and promoting scalp health, and review clinical data and technology of hair care for patients with dandruff. But first, we're going to do a polling question. So here's polling question number 1. After a hair wash, how many cells per centimeter squared gets shed in an average patient who does not have dandruff? So please vote. Is it 5,200, 18,000, 97,000, 241,000, 487,000? So please pick your choice and let's take a look at what you all think. Ashley, how's it looking? All right. Well, the majority thought 31%, well, actually a tie between 2 and 3. So the right answer is actually that 487,000. It's that very, very, very high number. So let's go to the next slide. So all right, so what we're going to do is discuss the challenges in hair and scalp health in patients with dandruff. So a lot of scalp conditions can compromise scalp health, and we in dermatology know what these are. It could be contact or irritant dermatitis from common things like hair dye, or having atopic dermatitis, having psoriasis of the scalp, tinea capitis, atopic dermatitis. All these conditions can impact scalp and hair health. And dandruff or seborrheic dermatitis are both associated with a disrupted scalp barrier that contributes to irritation, pruritus, or itch, and flaking of the scalp. And it's long been known that inflammatory scalp conditions negatively impact hair growth, but the characterization of overall scalp health and its impact on hair growth has been less evident in the literature. The flaking and itch associated with dandruff can significantly impact an individual's quality of life and even their self-esteem. And while the exact pathogenesis of dandruff is still not completely understood, scalp barrier health and the microbiome are thought to play significant roles in disease propagation. So dandruff and seborrheic dermatitis are common conditions. So we have dandruff and seborrheic dermatitis. Dandruff occurs in about half of the general population worldwide. Seborrheic dermatitis in the scalp is commonly called dandruff and is considered the same condition with, again, varying degrees of severity. The prevalence of dandruff and seborrheic dermatitis appears more prevalent among males, suggesting a potential androgenic component. And dandruff seborrheic dermatitis commonly affect younger individuals between the ages of 18 and 24, with a greater frequency in those over the age of 55 or under the age of 17. And I think for those of us who still might do inpatient hospital rounds, I remember rotating on the neurology wards and seeing so much seborrheic dermatitis in those patients, particularly in those with Parkinson's disease. But we do see this higher prevalence of dandruff seborrheic dermatitis in patients with HIV infection, neurologic or psychiatric disorders, as just mentioned, traumatic brain injury, spinal cord injury, depression, epilepsy, those with lymphoma, and sometimes in our organ transplant recipients. So how does it present? Well, it occurs as that white and yellow flaking and itch on the scalp and hair. And on the symptoms, they can be associated with itching and irritation that can spread to the hairline, the eyebrows, and retroauricular areas. And an itchy scalp can significantly impair a patient's quality of life and may be detrimental to self-esteem, as already noted. And it's been estimated that Americans spend $300 million currently on over-the-counter products to treat dandruff-associated flaking and scalp itching. There are multiple factors that are implicated in dandruff and seborrheic dermatitis. The scalp microbiome is one of those. And Malassezia, the yeast colonization in a susceptible individual with that disrupted skin barrier, leads to the production and release of irritating free fatty acids from sebum, which can trigger inflammation and hyperproliferation of the stratum corneum and further scalp barrier disruption. And disrupted scalp barriers make individuals more susceptible to microbes, itch, and further colonization with Malassezia, further perpetuating this cycle. So dandruff, again, is characterized by this disruption in that scalp barrier, leaving those who have dandruff more prone to, again, as was mentioned, further fungal colonization, environmental pollutants, and more inflammation. So it's interesting that recently patients with dandruff have been found to be deficient in ceramides. So the stratum corneum of patients with dandruff has an abnormal ultrastructure, including disorganized intercellular lipids. And individuals with dandruff have significantly reduced ceramides, fatty acids, and cholesterol compared to those who do not have dandruff. And you can see on the bar graph here, the blue will be your non-dandruff patients compared to the dandruff patients. And you can see that there's this decrease in ceramides, sphingolipids, fatty acids, and even in cholesterol. So the methods of that consensus paper that was published, so our group got together after, and actually we got together and defined the project. The panel was selected and a literature review was prepared with the data, and the draft consensus statements were drafted. There were meetings for these consensus statements that were developed and current treatment challenges for these conditions. Then there was a discussion of the draft consensus statements, adaptation, and agreement to the version that was used in the manuscript. So the searches were conducted in the English language from January 2010 to January 2024 on PubMed, the primary source, and Google Scholar, which was the secondary source. And the question that was asked is, what do we know from the literature about dandruff seborrheic dermatitis, over-the-counter scalp care products as monotherapy or adjunctive therapy for these conditions, and the role of ceramide-containing scalp care products? So what do we know? Well, the strategy, again, was the review process. And you can see here there were 401 articles, 345 were excluded. Those excluded included poster presentations, abstracts, book excerpts. And then the article types that were there, you can see that there were 84. And these included randomized clinical trials, or randomized control trials, cohort studies, case series, case report, chart reviews, algorithms, consensus papers, guidelines, systematic reviews, and meta-analyses and reviews. And again, these were the published articles from January 2010 to January 2024. So statement one out of these meetings and consensus and review of articles was: one, scalp conditions such as dandruff have oxidative stress as a common etiology. Oxidative stress interferes with normal scalp keratinization and affects hair follicle and cuticle health. So here we all know clinically what the presentations are of seborrheic dermatitis. You see examples, classic examples in panels A and B, and you can see the trichoscopic features. You can see perifollicular scale, diffuse scale. You can see scalp erythema, and then on histologic examination, you can even see that psoriasiform picture as you see in the lower right, and mild perivascular lymphocytic infiltrates. So coming back to this idea of oxidative stress triggering seborrheic dermatitis, the skin has defenses against superoxide dismutase and glutathione peroxidase catalase that neutralize these reactive oxidative stress things. And you have MDA and HODE are indicators of lipid peroxidation and oxidation in the skin. And when you look in the scalp of patients with seborrheic dermatitis, the levels of superoxide dismutase, catalase, and MDA are shown to be significantly increased compared to normal scalp, demonstrating a higher level of oxidative stress with a greater requirement for antioxidant defenses. So oxidative stress normally occurs through aging and interaction with our environment, but increased levels beyond the norm, so to speak, could be and are harmful. And oxidative stress to the skin leads to unhealthy scalp conditions and has been associated with seborrheic dermatitis and dandruff. That hair that comes out of the scalp is intimately connected to the surrounding scalp tissue and can be negatively impacted by poor scalp condition, impacting hair quality. Oxidative stress in the scalp could alter normal hair keratinization, and I'll show you some slides of that. Cuticle cells in the pre-emergent hair fiber are more brittle than normal and may impede normal fiber anchorage. The hair might actually come out easier or even break. And these cuticle alterations are very similar to those shown to occur from chronological aging of that post-emergent hair fiber. So here's what we're talking about. You have the hair fiber coming out of the skin, but if the scalp is unhealthy, perhaps impacted by ultraviolet radiation, chemical insults like oxidizing hair colorants or pollutants, or oxidized scalp lipids, this all leads to inflammation, and you have like a change that occurs in that microbiome of the scalp. So there actually was a study that looked at topical antioxidants, which improved scalp condition and reduced hair loss. It was a 24-week randomized double-blind placebo-controlled clinical trial showing that this regimen of the chemicals shown here on this slide, and they'll be present on the next slide as well, if they were present in the shampoo and they were left as a leave-on treatment compared to the vehicle, that scalp health improved as tested by transepidermal water loss and scalp biomarker values. And this was also correlated with reduced hair shedding. And the chemicals that were used here, these topical antioxidants, are circled here down at the bottom. And so the common ones that we're all familiar with will include zinc pyrithione, and the others listed here, caffeine, another formulation of zinc niacinamide, and it's also vitamin E. So statement 2 then became, dandruff is associated with an impaired scalp barrier, increasing the vulnerability to environmental pollutants, inflammation, and microbiome changes. So let's explore that just a little bit further. So here again, we have dandruff with many pictorial manifestations, the clinical ones as well as the trichoscopic ones. And again, we still aren't 100% sure what drives these processes in the skin, but clearly oxidative stress, changes in the microbiome, will impact what a patient experiences on their scalp. So in this particular study, the goal was to characterize the epidermal morphology in dandruff compared to healthy scalp skin and start to look at potential mechanisms. So biopsies were taken from 22 healthy female subjects and 21 patients with dandruff from lesional and non-lesional sites. And the samples were processed, sectioned, and stained using standard technology with hematoxylin and eosin staining. And what the investigators looked at is what happened to the epidermis. So measurements were taken of epidermal thickness, and also they looked with a marker called Ki67 to see what the cells were doing. So the changes were analyzed by immunohistochemical changing with Ki67 as well, and quantified using image analysis. So what did they find? Well, here, if you look at these pictures from left to right, you have on your left a sample of healthy scalp. And then when you start to go to a dandruff subject from a non-lesional site, you can start to see that the epidermis becomes thicker. And a patient with dandruff, you can see that there's that epidermal proliferation. When they start to look at the Ki67 stain, you can see that the number of positive staining increases. There are more cells picking up that stain as you move from the healthy scalp to the dandruff non-lesional scalp, and then to dandruff lesional scalp. Again, showing that there are these changes that are going on in the epidermis in patients affected with dandruff/seborrheic dermatitis. And this is just another way of presenting that data, where you see in these particular graphs, you see the healthy scalp, the dandruff non-lesional scalp, and then the dandruff lesion scalp, showing a much higher percentage of proliferating epidermal keratinocytes. So the conclusion here is that there were significant changes in epidermal morphology in the dandruff lesional skin compared with healthy scalp skin, including increased epidermal thickness, a more convoluted dermal epidermal junction, and elongation of reedy ridges, giving us evidence of an increase in the percentage of epidermal Ki67 positive cells, demonstrating dandruff is a condition which displays epidermal hyperproliferation. So let's then talk about a summary here, where people have also studied this abnormal scalp barrier and what it's associated with. And so one can find elevated transepidermal water loss, diminished levels of total ceramides, subclinical inflammation, and greater susceptibility to topical irritants. And was mentioned earlier, males have significantly lower ceramide levels per corneocyte and significantly more protein loss in response to gentle abrasion, implying impaired skin barrier in males, which could make their scalp even more prone to dandruff. And you can see the gender differences in the picture on your right. So in summary, dandruff and seborrheic dermatitis are associated with a disrupted scalp barrier that contributes to irritation, pruritus or itch, and flaking of the scalp, which can significantly impact self-esteem and quality of life. Severe or chronic barrier change can impair proper hydration, leading to atypical epidermal proliferation, keratinocyte differentiation, and stratum corneum maturation. The depleted and disorganized structural lipids are consistent with the weakened barrier indicated by elevated transepidermal water loss. And the presented consensus statements urge reframing our current understanding of dandruff and seborrheic dermatitis treatment by refocusing attention on global scalp and hair health. And now we'll turn the conversation to the next part of this webinar to Dr. Heather Woolreid-Lloyd.
Thank you so much. Well, I am going to get started and we're going to do another polling question. So let's see. I'm going to move forward. Let's see. Here we go. So let's do polling question number 2. And this question asks, after a hair wash, how many cells per centimeter squared gets shed in a patient with dandruff? So is it up to 500,000, up to 600,000, up to 700,000, up to 800,000, or up to 1 million? So we heard how many cells per centimeter squared were shed in patients without dandruff. Let's see how many you think are shed in patients with dandruff. So let's see what people are thinking. It was 400,000 for the people without dandruff. Let's see what we see here. Okay, we're close. So it's actually up to 800,000. So the majority of you said up to 1 million, but it's very, very close. It was almost double what we see in people without dandruff. And of course, we see that clinically. People with dandruff definitely have significant scale, and that's a lot of scale with each hair wash. So now we'll move on to my presentation, and we're going to discuss the importance of hair care in managing dandruff and promoting scalp health. And I'm going to do a little bit of background before we talk about hair care, and we're going to talk about the intrinsic and extrinsic factors that impact the scalp barrier, because when we talk about hair care and scalp health, we're really talking about the scalp barrier. So we know some of the intrinsic factors are things like sex or gender, hormone levels we heard about, sebaceous gland activity, skin lipid composition, immunity, and genetics. And there are even some recent studies that show that certain HLA subtypes have an increased risk of seborrheic dermatitis. Now, we heard earlier that men are more likely to get dandruff, and people also who have higher androgen levels are more likely to get dandruff and seborrheic dermatitis. And this may be due to the fact that increased androgens does stimulate sebum production, which we know is so important in the development of seborrheic dermatitis. So how does sebum production work in this? Well, we know that Malassezia, which is the fungus that we know is implicated in dandruff, has these lipases. And Malassezia acts on triglycerides and other lipids in the scalp and breaks down those lipids into free fatty acids. Now, those free fatty acids can be irritating, but they're not irritating for everyone. They're only irritated in people who are predisposed to seborrheic dermatitis or dandruff. So you can see in that study on that fourth bullet, there was topical oleic acid that was applied to subjects who had dandruff and subjects who didn't have dandruff. Now, oleic acid is one of those free fatty acids that's very irritating. And what they found were in the people who did not have dandruff, applying topical oleic acid did not induce visible changes. But in the patients with a history of dandruff, you did see dandruff-like desquamation. So this teaches us that patients are predisposed to seborrheic dermatitis or dandruff, and not everyone will get it. Only predisposed people will develop this condition. So what is Malassezia's role? We've talked about the fact that Malassezia has these lipases that metabolize triglycerides into these irritating fatty acids. We also know that Malassezia is involved in the consumption of these saturated fatty acids, leaving behind the unsaturated fatty acids. And these unsaturated fatty acids, one example is oleic acid, alters the skin barrier and induces inflammation. And that's why we see clinically flaking and scaling in our patients. So what do we see when we look at the microbiome of our patients with seborrheic dermatitis? This slide pretty much summarizes that, and you're going to look at the left side of the slide with all of those arrows. So we know that there's increased Malassezia, that's certain. We also know that there's increased Malassezia lipases. Those are the ones that are breaking down the triglycerides and the lipids into those irritating free fatty acids. There's also increased inflammatory markers, so cytokines like IL-1B, IL-17, inflammasomes like NLRP3, that's a long one, NLRP3, but all of these are inflammatory type chemicals that really promote inflammation in the scalp of our patients with seborrheic dermatitis. There's decreased microbiome diversity, and that makes sense because there's so much Malassezia, there's less diversity of the microbiome. There's increased staph in our patients with seborrheic dermatitis, something that we might not think about. Decreased Cutibacterium or C. acnes, and there's an increased ratio between the Malassezia and the C. acnes. So there's more Malassezia and less C. acnes, and that's what we see in our patients with seborrheic dermatitis. As we learned earlier from Dr. Hordzinski, there's an increased prevalence of sebderm in patients with immune-mediated diseases, so things like HIV, leukemia, lymphoma, organ transplants. And then I also think, very interestingly, there's an increased rate of seborrheic dermatitis in patients with neurologic and psychiatric conditions. That one, I think it's not as easy to explain as the immune-mediated disease, but this is a phenomenon we see in practice all the time. So patients with Parkinson's disease, tardive dyskinesia, traumatic brain injury, even depression are associated with higher rates of seborrheic dermatitis. So this brings us to statement 4, which says reducing oxidative stress, or this inflammation in the scalp, and promoting a healthy scalp barrier can reverse the detrimental effects of oxidative stress on the scalp and hair health. So that kind of brings us to the exogenous factors that influence scalp health, or our scalp barrier health. So we talked a little bit about the microbiome, and that is intrinsic in that it's a part of the skin, but lifestyle factors definitely influence our microbiome. So things like stress, climate, diet, all of those things can influence our microbiome. The other thing that we see in patients with seborrheic dermatitis and dandruff is that medications can also increase the risk of developing this condition. So anti-cancer drugs are associated with it, and also epidermal growth factor receptor inhibitors are associated. And then all of the psychotropic medications like haloperidol, lithium, and so forth. And then probably the thing we see most commonly in our patients are just exogenous insults from, hair care. So bleach, formaldehyde, high heat, UV radiation, all of these external insults that our patients have just in their everyday lives that can increase reactive oxygen species in the scalp and affect that scalp barrier. So what about the role of shampoo? We heard one study on this, and this is another study looking at how shampoo influences oxidative stress on the scalp. And in particular, they looked at a zinc parathione shampoo in this study, and they found that it could reverse oxidative stress on the scalp, and it caused the hair to be healthier. Basically, the hair had lower moisture absorption and decreased water wetting force. So it's like a shinier, stronger, healthier hair. In that study, over 3 weeks, the patients or subjects who used the ZPT shampoo also had a reduction in flaking, which we would expect, and they had a reduction in inflammatory markers and markers of barrier integrity, so keratin 1, 10, and 3. So we know that using a ZPT shampoo can obviously improve flaking, but in this study, it also reversed oxidative stress, improved the skin barrier, and improved inflammation. And then a different study showed the same thing. It showed that a ZPT shampoo improved the overall condition of the scalp as measured by inflammation and barrier integrity. Now, this is a big overview. This is a systematic review of topicals that we use for seborrheic dermatitis, and it includes prescriptions like topical steroids, topical calcineurin inhibitors, and it also includes lithium salts. And if you're not familiar with lithium salts, there's something that they are available in Europe. They're not available in the US, but lithium gluconate has been used to treat dandruff and seborrheic dermatitis. So in this large review of these studies, and there were almost 40 studies, a little bit over 40 studies in this systematic review, they found that topical steroids were effective for seborrheic dermatitis on the face and scalp. And interestingly, there was no difference between the mild steroids and the strong steroids. So sometimes we think, oh, I want to use a stronger steroid. This patient has severe sebderm. But in this study, there was no difference between the mild and the strong steroids in the short term. They also saw evidence that topical calcineurin inhibitors and lithium salts are effective. And so basically, we do have effective treatments for seborrheic dermatitis and dandruff. And I think what's interesting from this study for me as a clinician is that there was no difference between the mild and strong steroids when we're treating dandruff and sebderm. This is a different systematic review, but instead of looking at the steroids and the anti-inflammatories, it looked at the topical antifungals specifically. So this was randomized controlled trials of topical antifungals to treat sebderm in adolescents and adults. And what they found was that, of course, ketoconazole and cyclopyrox were more effective than the placebo, but none of the antifungal agents were clear leaders. So there was no evidence that one agent was more effective than another. Most of the studies were for 4 weeks, and we know that dandruff is a chronic condition, so it would have been helpful to see longer periods of the time. And they also found that ketoconazole had similar results to topical steroids or a steroid treatment for dandruff. But interestingly, in none of the studies, and this study was done in 2015 in this large systematic review, did they ever look at quality of life? And that's something that's interesting to me because now we do see studies looking specifically at quality of life. And this is so important because we know severe sebderm and even moderate or mild sebderm impacts quality of life. It significantly impacts quality of life to have flakes all over your shoulders, chronically scratching your scalp. It's embarrassing to be scratching your scalp. So it's a shame that in the past we didn't really look at that, but the good news is that studies recently have been looking at the impact of treatment on quality of life. So a summary of what we've talked about so far. First of all, we know that the data supports that a healthy scalp can influence the hair, and healthy scalp equals healthy hair. In these studies, most of the skin conditions have been looked at are psoriasis. So that's the one where we have examined the scalp the most. So we've looked at most studies of scalp health have looked at psoriasis, but this is followed by seborrheic dermatitis and then followed by atopic dermatitis. We know that these scalp, for all of these publications, we do have effective treatment, but we don't talk as much about adjunctive skincare or as monotherapy, so over-the-counter treatments, or as an adjunct to prescription treatments. The other thing that we know from these studies is that scalp conditions definitely have oxidative stress as a common etiology. An improvement in scalp health, it reverses the oxidative stress that has been demonstrated in these studies. And then lastly, I know there's a lot on this slide, and I'm going to be reading from left to right so you can follow along, but basically, if you want to think of the overall summary, we know that a healthy stratum corneum protects against external insults. And if you have barrier damage, that can lead to that atypical epidermal proliferation that we saw in Dr. Hordinsky's presentation, where the epidermis is thickened and there's lots of inflammation there. Not only are the keratinocytes affected, but there also is a disorganized structures of the lipids, and that's consistent with a weakened barrier. And then this weakened barrier may induce subclinical inflammation, especially in patients who are susceptible, because not everyone develops dandruff, it's the people who are susceptible. And then this whole conglomeration of events really primes the scalp for colonization of malassezia. And basically, when you have this malassezia colonizing the scalp, we see dandruff and that inflammatory cascade. So it's kind of this cycle. I'm going to talk about that cycle again later, but this is what we're seeing in the literature review. So how can we address this? Well, there are 3 new products that have been introduced by CeraVe specifically to address not only the malassezia, but the scalp health. And these 3 products are a hydrating anti-dandruff shampoo, a hydrating anti-dandruff conditioner, and a hydrating anti-dandruff 2-in-1 shampoo and conditioner. Now, all 3 of these have zinc parathione as an active ingredient. The cleanser, so the shampoo and the 2-in-1 have 1% zinc parathione, and the hydrating anti-dandruff conditioner has 0.5% zinc parathione. And then they also have 3 other ingredients, or 3 things together to help address the barrier, the scalp's health and barrier. And that's 3 skin identical ceramides, MVE technology, and niacinamide. So let's get into this. So as I mentioned, all 3 have zinc parathione, and we know that zinc parathione addresses the malassezia, treats the dandruff, helps to address flaking and itch, which is a big complaint in our patients with dandruff. In fact, that's one of the most common complaints is itch. That's the most burdensome symptom of seborrheic dermatitis. And then we have the ceramides that we know are in all of the CeraVe products, the 3 skin identical ceramides that are designed to help restore the scalp barrier. And then MVE technology, you might not be familiar with this, but MVE technology is a technology that allows for sustained release for hydration. So sustained release of the hydrating ingredients in the products so that that hydration occurs over time. And then that 4th piece is niacinamide, which is one of my favorite ingredients. It's anti-inflammatory and it can help to soothe the scalp. So this brings us to statement 4, and it talks more about how patients use how patients suffering from dandruff are dealing with their dandruff. So most people suffering from dandruff use a medicated hair care product such as a shampoo, but many have concerns about lack of cosmetic elegance. So let's get into that. So we can see here that topical treatments are effective. I've reviewed almost all of the literature. We looked at steroids and topical calcineurin inhibitors and topical prescription antifungals, and they are quite effective. The antifungals are considered the gold standard. However, the problem is that patients don't love the cosmetic elegance of a lot of our prescription therapies. So even though we know that they work, sometimes people have a lot of relapses or they simply don't use the products. And that's something I see commonly in my patient population, because my patients tend to have coarser, kinky, textured hair, and common prescription shampoos like ketoconazole shampoo can be very drying. So even though my patients will tell me, yeah, it works great on the dandruff, but my hair is so dry, I don't really want to use it. My hair is getting dry and brittle, I'm getting breakage. Even though my dandruff, itching, and flaking is better, I don't want to use this product. And I always like to say that this is kind of like sunscreen. We always say the best sunscreen is the sunscreen you want to put on, because we want our patients to wear sunscreen every day. And this kind of reminds me of sunscreen in the sense that since seborrheic dermatitis is a chronic condition, it's a long-term condition, you're going to have it for decades, you really have to have a product that you want to use. It really has to be cosmetically elegant, and this is something that is really what we need, is a product that works but is also cosmetically elegant. So they did a survey of dermatologists, and dermatologists kind of agreed with this sentiment. They said that their patients with dandruff think that their products work, but they don't use them. Their compliance was low. And then in the panel that was assembled for the paper that Dr. Hordinsky just spoke about, we talked about how OTC dandruff shampoos are effective, but compliance could be lower due to the suboptimal cosmetic elegance. Patients have to want to use their dandruff shampoo. This is a chronic condition, so it has to be really soft, for it to make the hair feel soft and be like a positive experience, especially due to the chronicity of this condition. What about the patients? What do they think when it comes to dandruff? Well, number one, and most importantly, and I think it's great news, they're seeking advice from dermatologists. So dermatologists are the number one go-to person when it comes to dandruff, and that's who they trust for their product recommendations. The second bullet there is that they desire treatment for their dandruff. So the patients who aren't using their products, it's not because they don't want to treat it, it's just because they may not be cosmetically elegant, and they really don't truly understand this is a chronic condition and you have to keep using your products long term. They want products that are gentle but effective. So gentle meaning doesn't strip the hair of its natural oils, is not drying, but gives very good results. And of course, patients are embarrassed by their dandruff, and this brings in that quality of life issue that I talked about earlier, where patients really, I know from my clinical practice and from studies, that dandruff and sebderm tremendously impacts quality of life. So let's talk and change gears a little bit and talk a little bit deeper into a new study. So it's a brand new research, exciting to present this tonight, looking at the scalp barrier function and ceramide levels in a diverse group of patients with dandruff. So this was a study that is a clinical evaluation of the scalp barrier. It looked at ceramide levels, it looked at the microbiome, and it says diverse dandruff patients. So it's all different types of patients. And you can see here, we keep talking about this cycle of dandruff, and we're talking about inflammation, malassezia, the inflammatory fatty acids, and we see this cycle here. So we don't know where it starts. Is the barrier first? Is the barrier disrupted first, and that's why the malassezia becomes overgrown? Or does malassezia become overgrown and that disrupts the barrier? But it's definitely a cycle, as you can see in this figure, and it's something that we have to address. Obviously, we want to address the malassezia, but we also need to address that barrier. So let's see what's going on with the barrier. So in this study, there were 106 dandruff patients and 106 patients with a healthy scalp. And the patients had mild to moderate scores on a 5-point scale. So they had scales, dandruff between 2, 2.5, and 3. And they did a full panel of analysis. So if you look all the way to the left on the bottom, they did clinical evaluation. So physically looking at the scalp, there were instrumental measurements. They measured ceramides and the lipid analysis. They looked at the microbiome. So they looked at malassezia and did whole gene sequencing of the microbiome. And then they looked for scalp barrier biomarkers, inflammation biomarkers, and did scalp imaging. Now in the study, it was adult patients, 18 to 65, male and female patients, all Fitzpatrick skin types and all ethnicities, which I love because this is something that we see across the board in all of our patients. So when you look at the demographics, the average age was around 40. And then as far as gender, the majority of the patients were women, slightly more women than men in this study. And you can see the breakdown between Fitzpatrick 1 through 3 and 4 through 6. Both groups were well represented. You can see all ethnicities, Asian, Black, Hispanic, and white. And as I mentioned, the IGA, or the Investigators Global Assessment Score, was mild to moderate, which is between 2 and 3. But they also had a scale of 2.5, so 2, 2.5, and 3. So let's look at the study results. So as we would expect, and when we look at these study results, the dark blue bar are the dandruff subjects and the light blue bar are the normal subjects who don't have dandruff. So when you look at this, when it comes to dandruff symptoms, it's not surprising. Our patients, the subjects who had dandruff had more erythema, more dryness, more flakiness, and look at that flakiness, it's very high, significantly more itching compared to the normal subjects. They also reported more tightness. So it's interesting though, some of the normal subjects also had itching and dryness, but they didn't have the flakes. And that's probably diagnostic, I would say, of dandruff, is that flaking. Now, when we look at transepidermal water loss and hydration, again, we see that the dark blue bar, which is the dandruff subjects, had higher transepidermal water loss and they had lower hydration. When you look at the second bar, you can see that the light blue bars are higher. So the normal subjects had significantly more hydrated scalps. And this is consistent with what we've seen in the literature in the past. We definitely know that patients with dandruff obviously have increased transepidermal water loss because of their damaged barrier and decreased hydration. This is probably what's contributing to a lot of the itching that we see clinically, because we all know that when you have dry skin on your body, our older patients who get xerosis with age, they're very itchy. Same thing if you have dry skin on your scalp, it's definitely going to, one of the reasons why I think that our dandruff patients are so itchy. As I mentioned, they also looked at ceramide levels, and they looked at levels in normal versus dandruff affected scalps. And they found that there were lower levels of ceramides AP, NDS, NH, and NP, and an increase in ceramides NS and AS, and an increase in free fatty acids. We would definitely expect that increase in free fatty acids. But I'm going to break this down a little bit more so you can understand that difference in ceramides. So ceramides, there's two types of ceramides. There are long chain ceramides and short chain ceramides. Long chain ceramides are long. They're the ones that really are good for the skin barrier. So they're important for overall skin health, are the long chain ceramides. The short chain ceramides actually can be a little bit disruptive because they're very short and they can disrupt that epidermal barrier. So what they found was that the dandruff affected scalp is associated with lower proportions of the long chain ceramides, the good ceramides. So they had less of the good ceramides and more of the ceramides that are more likely to cause disruption of the barrier, which are the short chain ceramides that you can see here. So I think that's very interesting. All ceramides are not created equal. It's important to understand that certain ceramides are shown to be beneficial for the skin barrier and the scalp barrier, and certain ceramides can be a little bit disruptive of the barrier. So long chain ceramides are beneficial. Shorter chain ceramides may be a little more disruptive to the skin barrier. What else did they find? Well, you know, from previous studies, we know that we're going to look at those arrows on the top bar there, that dandruff affected scalp is more likely to have less Cutibacterium, more staph, and of course, more malassezia. So what did they find in this study that was new? What they found was that the staph is Staph aureus and Staph capitis, and these tend to be more pathogenic. And there were lower loads of Staph epidermis, and that's the one that's kind of the healthier, more normal flora of our scalp. So we always think of dandruff as a fungal, has a fungal etiology. When we think of, issues with the microbiome, we're really focused on the malassezia, but staph is playing a role. At least it's altered in our patients with dandruff and sebderm. So increased Staph aureus and increased Staph capitis, and then decreased Staph epidermis. Okay, now this is something that's a little bit busy, but I'll break it down for you so it's clear to understand. They looked at some inflammatory markers that are suggestive of inflammation in the scalp, and that is the IL-1RA to IL-1A protein ratio. So what they found was, first of all, that overall the dandruff patients had higher IL-1RA to IL-1A ratio compared to subjects with a normal scalp. But what's even more interesting is that patients who had more severe dandruff, so they had an IgA of 2.5 or 3, remember they were like, between mild and moderate or moderate dandruff, were more likely to have this hallmark elevation of the IL-1RA to IL-1A protein ratio. And this ratio is a marker of a pro-inflammatory cytokine profile in the scalp. So what are the study results? Let's do our summary here. So first of all, we've definitely learned that there's an altered composition in the scalps of patients with dandruff. Remember, they tend to have less of the long chain ceramides, which are the ceramides that are associated with the healthy skin barrier, and more of the short chain ceramides, which tend to be disruptive to the skin barrier. When we look at the bacteria profiles, which we don't talk a lot about bacteria when we talk about dandruff and seborrheic dermatitis, but when we look at the bacteria profiles, there was an increase in Staph aureus, which we know is a pathogenic bacteria, and lower levels of Staph epidermis and C. acnes. We just talked about that IL-1RA to IL-1A ratio, and we found that scalps with dandruff have a higher level of this ratio, and that ratio is dependent on the severity of dandruff. So this is, suggestive that it's almost the more severe your dandruff, the more severe your inflammation, and that's pretty self-explanatory. And so the authors concluded that there's a need to protect the scalp barrier, and the proper composition of ceramides, ideally more of those long chain ceramides and higher content of the phytosphingosine based ceramides, may help disrupt the inflammatory cascade to be able to stop that cascade to alleviate the etiology of dandruff. So the concept or the conclusion of the authors is that if we have more of these long chain ceramides, the ones that are like restoring the barrier, that are more anti-inflammatory, we can stop the inflammatory cascade that we see in our patients with seborrheic dermatitis or dandruff. So this is my last slide, and I, just wanted to conclude this session, and then we'll have time for questions and answers on what we found and why this is so exciting. I think it's exciting because, first of all, we haven't really studied dandruff much. I think that for a while that dandruff and sebderm were kind of forgotten conditions in dermatology, and we didn't have a lot of new things. So it's fun to see lots of new research in this area, very, very exciting. We know that dandruff and seborrheic dermatitis, scalp health and hair health are all interrelated. So healthy scalp, healthy hair, unhealthy scalp, unhealthy hair. And our treatments really not only benefit the scalp, but also benefit the hair. And then I think also a very important conclusion is that really cosmetically elegant products are very important for our patients because of the chronicity of this condition. People don't want to use products that cause their hair to be dry, brittle, and break. They really want to use products that address their dandruff, but also improve their overall hair health. And we've seen some nice data on how we can do that with our newer topical treatments. But of course, even though we looked at some nice new data, I think definitely more research is needed in this area to really clarify the role of the scalp barrier and the microbiome and the interplay between all of these different variables in the development of dandruff and seborrheic dermatitis. So now I think we have some time for questions. Thank you so much.
So remember, if you want to submit your question, please submit your question in the question chat pane on the right-hand side of your screen. And if you think of any questions after this session, you can always send them to info@rbcconsultants.com. So we have a first question from our audience. And that for question is, in textured hair patients with seborrheic dermatitis, how frequently do you recommend hair washing?
So that's a really great question, because people with curly, coily, tightly textured hair or tightly coiled hair, the hair styling process can take hours sometimes. So it's not, although many times for our patients will say, oh, wash your hair every day with this dandruff shampoo or several times a week. If styling your hair takes 2 hours, that's not realistic for the average patient. And they're not going to change their hairstyles. It takes me 2 hours to get my hair done. So, we're not going to change our hairstyles. So I say once weekly is ideal. Now, people who have short hairstyles, or they have wash and wear hair where there's not as much styling, then they will be able to tolerate more frequent washing, especially with these newer products that are not drying to the hair. They're not going to, because what I found in my practice with most commonly ketoconazole shampoo is very, very drying. So people, even if you had a short cut and you could wash your hair more frequently, it was making the hair dry and brittle, and patients didn't like that. So I would say once weekly is what I would recommend. And then for people with short hair who can wash their hair more frequently because they don't have a whole long drawn out hairstyling process like me, they can do it more frequently than that, maybe 2 or 3 times a week.
So I'd just like to add to that, because I think clinically what we see in patients who have hair diseases, whether it's alopecia areata or a scarring alopecia, where hair's prosthetic devices are present on the scalp and people don't shampoo frequently enough and completely stop shampooing, where we see a lot of scale and changes in the microbiome of the scalp. So I think in clinic right now, we're trying to address that in patients as well. So I think there are 2 parts to this. Is that scalp health, and it's that textured hair or fine hair that we all have to think about.
Another question is, does the use of these new products alleviate scalp itch?
So I can talk clinically from my own personal experience and my patients who have used these products, there is a significant reduction in itch. But I think that some studies are underway looking specifically at that. But just from my anecdotal in my clinic and Dr. Hordinsky, what do you think?
I agree with you, but then when you do trichoscopic examinations of the scalp, one can still see in a lot of these patients that the scale's kind of lifting up from the scalp. There's still perifollicular scale. So one of the things we still are challenged with is really teaching people how to shampoo properly. Like, how do you really remove that scale that's already uplifted with what you're doing, and how do you remove it gently and without causing more trouble, so to speak?
Yes, and especially in teenagers, because dandruff is a big problem in teenagers, and teenagers, I feel like, don't really understand how to shampoo their scalp. And so there is an opportunity for us to teach our patients, we might not think, what we would typically say is use the shampoo, a couple times a week or 3 times a week, but we might have to think in our teenagers, what do you do when you wash your hair? What exactly do you do? And kind of correct behaviors, and I oftentimes will say maybe do 2 or 3 washes, especially again, in my patients who don't wash their hair as frequently, they might do 2 or 3 cleansings to really remove what's built up during that week. So at least 2, it's very common.
I think you bring up such a great point. I can just see the young male patient with acne and seborrheic dermatitis and dandruff. And when you really start to talk to those individuals, like, how do you use these products, that you can be very surprised.
Very surprised. They're like putting it on their hair and not realizing it's going on the scalp.
Exactly.
Another question that came in, does the shampoo or conditioner affect dyed hair?
Well, that's a great question, because I hear in clinic all the time, and I bet Heather, you do too, in individuals who color their hair, that they really are concerned about whether the product is altering the color of their hair. And I think we have to be watchful of that, because people will travel, go out in the sun, that they're going to get their hair bleached by just sunlight and a change in the keratins and the hair fiber and all that sort of thing. So there are so many factors that can impact color in a hair fiber. This is just potentially one of them. So it's definitely worth asking patients about not just the use of their products, but everything else they're doing. That environmental damage that we talked about earlier is important.
And I'll say in this newer product that's on the market, I have not had anyone complain of changes. I think that they did address that and look specifically to see, because that's such a common complaint. So it's a really good question. But I haven't seen anything reported, and I don't think it was reported in their studies of this particular product.
What are your thoughts on using fine combs designed to lift scale from the scalp, as seen on TikTok?
I know
Well,
you go first, Maria.
I'll go first. So
You are the one who taught me about all of the new scalp treatments and so forth. So I'd love to hear your take on that first.
Sure. So what do we hear from patients? Patients are buying a lot of things on Amazon, and so they're using these scrubbers to lift that scale off. And then we have patients who are buying these trichoscopic devices off of Amazon, and they're coming to clinic with pictures that they've taken of their own scalp, their own trichoscopic pictures that show the scale and redness. So just like when you comb or brush your hair, these trichoscopic devices can pick up, like if you run a comb on the skin, you're going to see a red line there. So are you going to lift the scale up? You just want to find that right balance between causing injury or more quote unquote environmental damage to the scalp, and really trying to work to lift some of that scale up. And so some of the devices that we use a lot to remove scale will be, there are different devices that actually use water. So the water is squirted out on the skin and you just basically suction up the scale. And those work beautifully and probably a little bit better than using a comb or vigorous rubbing. What do you think, Heather?
Yeah, I agree. I love that idea of water. Now, for my hair type, that wouldn't be great because I don't want any water touching my hair. But 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 I think for people who really have this, I definitely think those water devices are much more gentle. And I just worry that people are just gonna, I mean, we would all have this predisposition. Once you start seeing that scale coming up, when do you stop? So I've definitely seen that. I'm very active on social media and I've seen those videos where people are like peeling off their scalp, but I would much rather prefer that they use a medicated shampoo, a medicated conditioner, calm that barrier down and approach it that way. I do see why people want to remove thick scale, adherent scale, but I'm just worried that people get too aggressive. So I'd like that hydrotherapy that you mentioned.
Well, that's all the time we have together this evening. We'd like to thank again our sponsor, CeraVe, for making this educational event possible. We'd also like to thank Dr. Hurdinsky and Dr. Willery Lloyd for a really thorough review of all the literature on dandruff and seborrheic dermatitis, and also new data, which is super interesting. As you said, it's been a while that we haven't seen new data in this area, so it's very exciting to see new data that'll help dermatological patients around the world. So thank you all for joining us this evening. Good night, everybody.
Good night.
Can we still talk?